of whether Obamacare is constitutional. Is it good for people? Dr. Manisha Sharma of the group Doctors for America says yes, and in fact, government should do more to provide health care for people. John Goodman says no, government should do less. He heads the National Center for Policy Analysis, and he's specialized in health care. So why should government do less?
Well, right now we have a bureaucratic, wasteful, inefficient system, and when government nationalizes it, it will become more wasteful, more bureaucratic. And the only way out of our problems is to free the doctors and free the patients, let them use their intelligence and creativity to solve their own problems. We're not going to solve these problems from Washington.
And you, this week, released a new book called Priceless, and priceless is part of your meaning is that nobody knows in medicine what things cost. The patients don't know, the doctors don't know. Why not?
Nobody sees a real price in health care, no doctor, no patient. You know, poor people with food stamps go into a grocery store, they pay the same price as you and I pay, they never have a problem with access. In health care, we let them do that, they have a huge problem of access.
Dr. Sharma, you had appeared at an event with President Obama promoting Obamacare. You say this is great. Why?
I believe that this is a great step forward in our health care and for our country, for us to be able to have better health for everybody in America. The bottom line is that America's health care is failing, and this is a great step forward in being able to make it into a patient-centered way of taking care of people.
Sounds good, John. Patient-centered. And the applause, I should say, she has a group of doctors she's brought with her, 10 doctors, who agree with her on this, and we'll be hearing from you later.
Here's the great irony. For our most vulnerable populations, they're going to have less access to care, not more.
Why?
What this bill does is greatly expand the demand for care. It's not just 32 million newly insured, but you and me and all the seniors, all the rest of us are going to have more generous insurance than we had before. So huge increase in demand, no change in supply. That's a huge rationing problem. If you're in a plan that pays below market, as like seniors and the disabled on Medicare or poor people on Medicaid or newly subsidized people, if we follow the Massachusetts example, they are going to have a real problem finding a doctor who will see them.
So actually, I disagree with you. I'm an everyday doctor taking care of everyday people. The notion of knowing that there are going to be more doctors to take care of more people and that there are provisions in the Affordable Care Act to let that happen is a good thing.
But I'm not getting it. I mean, government isn't good at running things. It couldn't run steel mills or even produce food in the Soviet Union. Why would it make health care better?
Well, the government gives us protection, does it not? It does a good job in giving our cops and our firefighters
Well, that's
money.
local government.
But it's local
we like that.
as well, but there's the whole notion of being able to say, look, you're starting on the factor that you're saying that health is a commodity. I start on the factor of saying that health is a right. So the notion
health care is a right.
There is nothing in this legislation that gives anybody a right to any particular health care.
What do you mean? It's free. It's the government's going to bring it to you.
It does not give you a right to a CAT scan, to heart surgery. It doesn't even give you a right to wait in line. If you're the 100th person waiting for a CAT scan, that doesn't mean you have a right to the 100th scan. In Massachusetts, which is the model for the federal legislation, more people are going to emergency rooms now than ever before. Boston cab driver told me the other day she had to go down a list of 20 doctors before she could find one who would see her. And I said, were you going to the yellow pages? She said, no, this was the list the government gave me. All that's happened is we're just moving money around. People are not getting more care.
Well, actually, I disagree with you. The fact of, I'm sorry, you're a nice Southern gentleman, and I feel like, you're welcome. I do feel like that, and in no disrespect, you're a numbers person. I'm an everyday doctor. And the fact of the matter is, in Massachusetts, actually 98% of Massachusetts is actually covered. The bottom line about it is that this is allowing us to expand care for people. It is closing the gap. 50 million people were uninsured. The Affordable Care Act is giving us 32 more million people to be able to get some quality insurance.
All right, the majority of America is on her side. You know, I'm looking at these poll numbers. 72% of Americans support subsidies for the poor to buy health insurance.
I support a reasonable government policy to help poor people, but that would be giving them money to buy private insurance, not going to rationing.
Excuse me, but I don't think it's just about poor people. This is about everyday people. This is not about a socioeconomic
All right, but let me go
divide.
down this list from the poll. It's all on your side. You should let me do
No,
that.
of course.
63%. Well, just because most people agree with you doesn't mean that you're right.
No, I'm not.
back to the poll here. 63% support government setting minimum standards for a health care plan.
These aren't minimum standards. The federal government will tell you exactly what kind of health insurance you have to have, where you're going to get it, and what you're going to pay for it. You're going to have very few choices.
Frankly, to be honest with you, I don't think insurance companies should be in the game personally, because this is not, health is not a corporation.
You just want full, like Canada has, government.
Well, I think single payer, if you actually look at the evidence that shows
that's
it,
government
it's
health care.
Social responsibility that everybody pitches in. So the bottom line is that here's
everybody
the thing.
pitches in. That sounds nice.
Yes, but everybody doesn't get the same care. And as a matter of fact, uninsured people in the United States get as much or more preventive care, more mammograms, pap smears, and so forth, than insured people in Canada. Think about that.
No, that's actually not true.
That is absolutely true.
Well, there is a lot of controversy over what's actually happening. The evidence-based medicine has shown in that regard.
61% of Americans support banning discrimination for pre-existing conditions.
Yes, absolutely.
Doctors are applauding here. Everybody discriminate. You for discrimination, Goodman?
I'm for people being able to insure against pre-existing conditions. That's what you do with life insurance. You buy life insurance, you get cancer, you die, your family gets the money. I'm not for allowing people, as this bill will do, to wait until they get sick. Then you buy the insurance, get your care, and drop the insurance again.
Yeah,
That's not going to work.
What about that? Why should I buy any insurance till I get sick?
So the fact of the matter is that's the whole idea, is to actually refocus on preventative care. So let's talk about pre-existing conditions very clearly here. So what are pre-existing conditions? Insurance companies were allowed to say, you have an allergy, you're a pre-existing condition. I got hit by a car, I'm a pre-existing condition. To me, that doesn't seem fair.
Do you know it's illegal in practically every state for your employer to buy insurance for you that you own? Why don't we change that law? We solve 98% of all these problems.
You guys will have more chance to answer the audience questions later. Thank you, Manisha Sharma and John Goodman.